Hey chiropractors, Brian Rector here from Innate Coaching Consulting with your weekly insight from Innate Coach. When I talk to doctors and we're working on how to communicate with their patients, the main thing I work on is this thing called micro-agreements. A micro-agreement is something where you acknowledge the patient and get them to say yes back to you. So for example, when I'm talking to a patient, I would say something like, Mary, I understand that your pain is on the right side and it's going down your right leg to about your big toe. Is that true? Then I look for Mary to make a micro-agreement, meaning shaking her head yes. Throughout the consultation in the ROF, we're looking for these micro-agreements from our patients so they know and we know we're on par with each other and we're communicating well. So for example, I continuously check in with the patient saying things like, so Mary, if your pain didn't go away in your right leg and it continued, how would that make you feel? And then she would repeat back to me saying something along the lines like, I would not be able to lift my children, I would not be able to play golf, the symptoms and the problems can go on and ever. So what I do then is that I give Mary a micro-agreement back by saying simply, yes, Mary, that is true. That is absolutely true that can happen to you. So this continuous communication, looking for these micro-agreements between the patient and the doctor will bond the communication beyond what you're normally used to in a doctor's office, but these patients will follow you and look at you as mentors. As mentors, our patients will follow us and listen to us when we talk because they know and we know that we understand what they're going through. In earlier insights from Innate Coach, I've talked to you about communicating with rapport. One of the biggest strategies in rapport is getting the micro-agreement. This is Brian Rector with your weekly insight from Innate Coach. See you next time.